It was on this day 5 years ago that President Donald Trump declared COVID-19 a national emergency. Thanks for joining us again as we wrap up our COVID-19 series 5 years later. I'm Bailey Strohl with Mike Landis here on the Ozarks First digital desk. And it's been interesting to look back on what has happened 5 years ago. And we've said every day it doesn't feel like 5 years, feels like a lot more than that.
Yeah, some people are telling us online it seems like it was 10 years ago, 25. It's hard to believe that, the pandemic started 5 years ago, but really went on for 2 years. So we've been out of it for about three-ish, going on 4 years. And even that's hard to realize, because when the pandemic was going on, it just seemed like every day seemed like an eternity almost in that world. And so for a lot of people, it's a somber milestone that we've made it this far. And during that time, we weren't sure what the world was going to look like.
No.
And I think I mentioned yesterday, we're surprised in a good way
That we have been able to recover.
some semblance of normal. I mean, it's different, but we got back on track.
Yeah, absolutely. And one thing I hadn't mentioned yet was just how familiar some of these faces became to a lot of us. I mean, people in general in Springfield, how many knew who the health director was, and how many had heard him from him or her, before this happened. And so some of these city officials and some of these meetings became very popular as some of this stuff became politicized and people were debating it. It was just a strange thing, but it come on the other side of it, though. I think people started getting involved in the community again because they wanted to know what was happening and what ordinances were being passed and what can you tell someone to do and what can't you do.
It was a very controversial time, and as you were mentioning, the outcome of that was people got involved civically. Obviously, there were people on both sides of a lot of issues when it came to things like mask mandates or vaccine mandates, but we saw a lot of people who maybe in years prior they just kind of sat on the sidelines, didn't know what was going on. They got involved and made their voice heard, whichever side they were on.
And it was nice to see for us on the news side to get some other perspectives and be able to get out and talk to people and have people maybe more willing to go on camera because they are so passionate about whatever they were talking about that day. One of the main things we are going to talk about today is masking, testing, and vaccinations. People were very vocal about that over those years or those months. So we were talked about on March 13th, 5 years ago, 2020 is when Trump declared COVID-19 a national emergency. That's when some travel bans went into effect that same day. On this day, Governor Parson declared Missouri in a state of emergency. And that's when we started seeing churches start canceling. I think that was the first thing that we kind of reported on because you couldn't have groups of 250 plus anymore. So it was weird to see those parking lots empty on Sunday mornings.
Yeah, that was very controversial too because people didn't want to be told to stay inside their house. We're used to having freedom. We're used to being able to get in the car and go to the store or to church or wherever we want when we want, and it's always been that way. And so people were told, even with good reason, that the health authorities thought they had, they didn't want to hear that. And I know there's a lot of pushback from a lot of churches saying, if there was ever a time that people need churches, if they need a place to go to have, comfort or that community, now is that time. But health officials thought they needed to do something to get on top of this to prevent that spread. And we did see instances, which we'll talk about here in a minute, about some of that spread happening when everybody got together for events, whatever those might have been.
Yeah, many of those that happened. And we didn't mention the Great Clips. That ended up, the Great Clips Salon, where that was one of the first outbreaks that was watched. And it ended up being a CDC kind of report, a case study, ended up being that out of Springfield just to see how it was transmitted. And I think that is to the credit of our health department for following it so closely. So they had that data to give to the CDC to kind of do a case study on it. That was interesting. One thing we didn't mention.
And that was interesting because with that Great Clips, that was one of the first, as you mentioned, case studies. And in the beginning, the health department was doing the contract tracing, as we mentioned. And it got to be so much they couldn't do that. But I remember the news stories in those first few days of there was a person who had COVID who was at the Great Clips, or they went to a Walmart. If you went to that Walmart or the Great Clips.
Yeah, we were putting that on the news every day. If you were here at this time.
And there might have been, one or two businesses every day. And it got to be just way too much because it was everywhere. But that just shows you how quickly it kind of blew up, because in the beginning we were able to pinpoint businesses or churches or workplaces
Yeah.
on where you might have been exposed to it.
And then it quickly just got out of hand.
From there.
Couldn't do it anymore. Let's show you some sound bites of our coverage from back then.
Bad allergies, and I didn't want to seem paranoid, but since I found out they were offering the free testing, I decided to go ahead and do it.
I just figured anytime there's an opportunity, I'm going to go ahead and take it if I can.
It was painful but quick.
It's bad, not too bad, kind of like the flu test.
It was a little painful, but I was aware that that was the case.
I know we have a big medical community here, and they believe in masking, and so that's a debate for the medical community. But for citizens, the big question is, can you constitutionally mandate and make people wear a mask if they don't want
to protect others. I'm against forcing people to wear masks. By all means, if you feel like you need to wear a mask, I'm all for it.
It's a 99% recovery rate. The 1% is horrific. Of course, we don't want to see anyone die. But let's get our stats correct before we start forcing a mandate on the people of Springfield, Missouri.
A lot to unpack there. So that started with my coverage at a mass testing site set up at the fairgrounds back then, just asking people why they were there, and them telling me how it went with that uncomfortable swab up in the nose. And then in the second half of that was the lawsuit that came out on the masking ordinance in Springfield. The first day of the statewide shutdown in Missouri was 3/15, so this happened a little bit after that, after the masking ordinance started being talked about. And that's kind of when people got a little divisive over the masking ordinance, and people had their thoughts. It was a balancing act of, do you not want to be told what to do, or do you want to just do it to protect yours and potentially other people's health?
Yeah.
And you see how that played out there. It was absolutely incredible to see 60 plus people signing up to speak at the Springfield City Council meeting.
Yeah, and I remember that evening quite well, watching it online, because they encouraged you if you didn't have to be there.
Prime time watching at that time of the city council meetings.
Been the latest city council meeting. I mean, between the two of us, we've covered a lot of city council meetings in our careers, and sometimes they go pretty late, but that was by far the latest.
Like well past midnight.
Yeah, and they were lined up, and I remember there were some people that were very heated, very upset. I mean, I remember hearing some people screaming and crying. I mean, they were very passionate about this on both sides of the issue.
Of course, yeah. So we can keep going down the timeline here. 3/17, March 17th is when administration asked Congress to send Americans direct financial relief. That's the stimulus packages we got. And I mean, I think for some of us, of course, they needed it to live, some people who had lost their jobs, but it was really just that to stimulate the economy. And I think people actually did make some big purchases from that if they still had their jobs and were employed. And, people were buying cars before the shortage happened.
Yeah.
People were making big purchases, and it did help. It did help us. I mean, we still entered a bit of a recession.
Sure.
Yeah.
And even that was controversial in itself. And this is, hindsight's looking at this. But there was a lot of people saying, we don't need this. This is a waste of government money. But I never heard about one person getting the check
and wishing that they hadn't got it.
Everybody spent it. I mean, they might have thought that it wasn't the right thing to do or that we didn't need it. But in the end, everybody put it to use somehow.
It was used. March 24th, that's when the city of Springfield issued the 30-day stay-at-home order, and that's when the debate over non-essential, essential employees, where can you eat, where can you sit at a bar, where can you get your hair cut, what qualifies as an essential employee. So a lot of things up for debate at this point.
Yeah.
COVID-19 deaths in the U.S. passed the 100,000 mark on May 28th. Widespread COVID-19 testing at the Ozarks Fairgrounds, that happened on June 4th. On June 10th, U.S. COVID cases reached 2 million. And then kind of the second wave, or the first real wave in the Ozarks, began in July. I remember Steve Edwards, the Cox Health president, saying that we thwarted the first wave with all of this stuff. I mean, that stay-at-home order only lasted 30 days, so that was into mid-May. Then we got out of it, and by July, we were seeing cases again.
Yeah, I remember those numbers adding up quickly, and I'll be honest about this. And I know I'm not in this, in this boat by myself. I don't know if you remember, but there was a website or an app that basically collected information from all the countries, all the health authorities, and it was a daily COVID total. It was a total of how many people had been, confirmed to have it, how many deaths happened. And so I remember I got to a point where, if you were out of work, if you were just at home, I remember sitting there scrolling and updating several times a day, and that was not healthy. But it was just, your mind was kind of mush at that point, and seeing those numbers did not help. But you kind of needed to be aware of the severity of the situation.
Yeah, and as a reporter at that time, it was all about the numbers. It's what percentage did it go up from the day before? We're seeing this many daily cases at this point. We're seeing this many deaths. This many people are in the ICU. This many people are in the hospital. This many people are on ventilators. This many people have been vaccinated. We're trying to hit that percentage mark. How many doses do we have? So it was just a lot of numbers coming at you at once, and a lot of information to get out on phases of recovery, phases on vaccine doses, and it's a lot of stuff to keep up there.
Yeah, and we're having difficulty adding up these numbers and talking about this even this many years later, so you can imagine those in charge of getting the information out at the time, how overwhelmed they were trying to, process all of this.
Absolutely. Looking back, it has been a real challenge this week to find out, and when was that second wave? And was it the Delta or the Omicron, On 7/13 is when Springfield City Council officially passed the masking ordinance.
Yes.
And that's when some of those, this protest video you're seeing and the sound bites you heard of those people inside City Council. Cox Health opened up its new COVID ICU unit 2 days later, and they said, they were prepared. And eventually that IC unit would be maxed out, and they had to move even onto a different floor.
I remember the pictures and the video of that. It was pretty mind-boggling to see that entire floor lined up. It looked like a ward in a war zone, just bed after bed. You didn't have your own little private room. I mean, this was beds lined up. On that section of the hospital. And I do believe it was when they had constructed that new tower, it was one of the floors that they were planning to build out eventually when the need arose.
Yes, it hadn't been used yet.
So they had that entire floor, and it was full.
It's like the 5th floor or something like that.
Full of the beds that they had for that.
Yeah. And the Great Mask debate, of course, came after that and continued and continued. The city council had ended up extending the masking ordinance in October. So at this point, we had been in it for several months. And then 2 months later, in December, is when Springfield started getting those vaccine doses. And it went out to nurses first. And I believe I have some sound bites from those first nurses and Mercy Hospital. That was a big day in Springfield. It got there at like 6 a.m. or something, and then they started giving it out right away to the nurses, and they were kind enough to send us video of that and some of the nurses talking about that, and then started that process of setting up mass vaccination sites in Springfield to get everybody else and work through the phases. And so here's some video now of that Cox ICU and then the mass vaccination sites as well. Let's hear from some parents that I spoke to back then about getting their kids vaccinated and those nurses.
We're part of history now. We're high risk, and so now I can feel like I'm doing even more to protect my family.
Relieved, excited, a little bit more hopeful for the future maybe.
If the parents do choose to do it for the children, then absolutely go for it. My children will not receive it. Just because I don't know exactly what my second dose is going to do to me.
Yeah, we'd be interested in that, getting them vaccinated, because we want to get, the kids taken care of as quickly as we can. That way we can, sort of get on the path to transitioning back to normal,
And that ended up being the way that we did get a little bit back to normal, was getting those vaccination rates up. I don't think they ever hit actually the goal that we had in Springfield for the timeline and the percentage. But I mean, I could just see once vaccines started being administered, cases started going down. But as a parent, it can be scary. You get your shot. I know I felt like crap for a couple of days after getting that first dose. And so speaking to that parent outside of Pipkin Middle School that day, she said, maybe I won't give it to my kid because I know I felt bad. So I don't really want to put that on them. But, you know, you got to weigh the pros and cons.
And I remember the same thing, having my initial COVID booster shot. I'm just real sensitive, it seems like, to those, because I've had the flu shot many times in life before, and I kind of feel the same way. You feel like you're sick immediately afterward for maybe a day because your body is fighting off what it was given a little bit, you know. And so there was a lot of people that were not wanting to do that. And when you had to go to get your booster, at that point you knew, I'm not going to feel so great for the next few hours, but it was, you know, what health authorities were saying we needed to do to get back to that normal, you know, be able to get the world back on track.
And during that time, I think it was more in April or towards the spring when it kind of opened up to everybody to get those. The first one came in December, but then by spring we were able to get it at the mass vaccination sites there.
Well, and there. Old Goldman's building, I remember that was one of them.
I know, the old Goldman's building. And walking into that space, it was very interesting for me because it was just one of those things where you've never seen that before in your life. When have you ever seen, you know, a health department take over an old retail space to put shots in people's arms? It was just kind of eerie, you know, but also very hopeful at that time that we had made it to that point. I remember sending pictures to my friends saying, can you believe we got here? They were talking about a vaccine for so long, and if we were ever going to be able to develop it, and then, you know, it's here and it's actually getting shot into your arm that day. It was just and then the cards that you needed to carry around, and should you laminate it, should you not?
Right.
And
and it's interesting because I remember going to those mass vaccination sites, you know, to get mine. And I think one of the ones I went to was the old Price Cutter building at Grand in Kansas, which is now Jordan Valley Community Health.
Yes, that's where I ended up going. Yeah,
and
it
so
wasn't
walking in there and you saw just like hundreds, maybe thousands of people lined up. It was surreal.
It is surreal.
But what in our life at that point was not surreal day by day. You know, it's like every day was something you knew, and we'd experienced a lot that we never thought we'd see in our lifetime. And so that was just kind of a continuation of that. But that was a positive thing, being able to hopefully, you know, get us where we needed to be health-wise.
Absolutely.
Yeah.
And it, once people did start getting those first doses, it kind of opened people up to be able to travel again.
Yes.
I know that's the first time I saw my family, extended family, after I got my first dose. We finally took a little bit of a trip, very carefully, of course, but it was all that pent-up lack of taking time off.
Yeah.
People were burnt out.
They were.
And then we saw that influx of people getting outside and trying to take trips after that.
I remember that. Yeah, and I remember when the vaccination rates got to a point where they thought they could start opening things up slowly.
Yes.
And they opened the Battlefield Mall. The stores in the mall mostly were closed, but they were letting people actually in the doors to just walk around. And that was strange, being in the
video
mall,
of that earlier.
walking around and seeing that. You know, you've been going to the Battlefield Mall all your life, and I enjoy going to the mall, but I never realized how much I would enjoy going to it.
Going back. You didn't know
until
if these places were ever going to come back. I mean, a lot of places didn't. They had to close down, and, you know, movie theaters, restaurants, and they didn't make it. So that was one kind of semblance of normal, just to go to the mall, you know.
Stuff that was just everyday life that you never thought twice about suddenly became a treat, you know, to get out and do.
So now we're well into 2021, kind of the timeline we're talking about here. And in July, we got a new variant. And that kind of, I think, canceled out some of the vaccination that we had been able to get, or the immunity that we had been able to build up. And it all kind of started over again. And so by mid-July, we were right in the summer surge of the Delta variant.
Yes.
And it was exhausting Springfield hospitals. There were, at one time, on that day, July 19th, I reported there were more than 250 COVID-19 patients in Mercy and Cox, and they predict that number would double in the next month. That is a lot of people in the hospital with a virus.
And that was a little deflating for everybody because, you know, life was starting to get back around. We were starting to be able to get out and enjoy life a little bit more. Some people being able to go back into their jobs and work. And so when we started those numbers kind of flipping around. I think that's when we realized, and I remember the doctor saying, once we get through this initial thing, COVID will end up being like the flu that we're going to just deal with every year. Like the severity of it will go down, but we'll have it every year. And so I remember when that second wave came around, we're like, oh my gosh, like this is going to be a forever thing.
Yeah. And at that point in time, the hospitals, Mercy said it was averaging about 2 deaths per day, and 40% of Greene County was fully vaccinated. So there were a lot of people that had gotten more than 1 dose, and we were still becoming that hot spot. One of the days that really hit home was right around this time. I was doing my live shot at 5 and 6 outside of Mercy Hospital, and a CBS reporter, a national reporter, was standing next to me doing her live shot, essentially doing the same story that I was doing, because that's where she had been sent to Springfield, was because we were getting 500 cases a day.
It was an epicenter of it, and a lot of eyes were on us, wondering, how has this happened? And that was all that pressure on health authorities to get us back under those numbers. To get that tide back under control.
Let's see here. By then, so we're going way farther. Springfield leaders at one point had to pass the responsibility onto the public. They said, we're not going to do this anymore. I mean, we can't keep telling you to mask up if there are vaccines available. And, so at that point, when all of this was starting to get passed on to the public for their responsibility of it, it had been about 14 months since restrictions had put in place, and then the city said it was finally stepping back. I think, so I kind of skipped ahead here. The hotspot began in July, but the masking ordinance had ended in May. So that kind of shows you masks might have been working, they're gone, and 2 months later, we were the epicenter of the U.S. So,
and by then we had learned some additional stuff. People were using all kinds of items for masks. There were some that were thick that were made to be masked, but I remember seeing people making, improvised masks in public. They weren't the N95, and so health authorities were finally saying, yes, having something over your mouth, whatever it is better than nothing, because when you're sneezing and coughing, that's at least controlling that. But the N95 masks are what's going to work the best. And so I remember, everyone's got to get an N95 now, and then you'd go to, Walmart, and they were sold out, in Target and Lowe's, and I remember, looking for some of them, and I think by that point I was here at the station. I'd come back to news, and so we were able to find some. I don't remember where we had them. I had them in my desk, honestly, till a few months ago, thinking you never know when we'll need them again.
And it was tough too. For a while we were using the cloth masks because that's what was available. And if I didn't come to work with one and I needed to go do something, I mean, what was I going to do? I had to scrounge up and find one there for a while. So it was, a lot of responsibility just leaving the house that day. It wasn't just phone, wallet, keys. It was phone, wallet, keys, mask. And hand sanitizer and, stuff like that. So the mass vaccination site was, and the end of the masking ordinance and passing the responsibility on. We got through finally the hot spot, I think mostly because of immunity. At that point, everybody got sick.
Which we knew we would build that immunity. Even health authorities were saying, the vaccine, that's to get the rates low enough to where we can start building that herd immunity. And that has worked. And that was one of the things that they knew would happen, because we've had other pandemics of types in the past, or even sicknesses, or we can even look at the annual flu numbers. And knowing that's kind of what happens. You eventually build that herd immunity. So toward the end of the flu season, cases start to drop off, and that's why the flu season ends, is because enough of us build that immunity going forward.
During all of this, I can't remember exactly where it falls on the timeline, but there was a remembrance held by city leaders to honor the people that we had lost throughout all of this. And it was a really somber day to watch that. I was watching it via the live stream from my little desk in the back corner on the second floor here. And I just had to break down at one time, because it was just one of those days. It's like everybody's crying, everybody's looking back, and you just got to give yourself that moment every once in a while to kind of absorb really all the tragedy that you had seen and been hearing about. And for those first responders, I mean, not only are you witnessing death and witnessing heartbreak all the time, but you're doing it with layers and layers and layers of stuff on top of you just to keep yourself safe. And then you have to go home to your family that night. It's just, it's really, really heartbreaking.
And making sure that even today that we don't forget the loss we endured, or the loss we endured, because obviously we can sit here and talk about and celebrate, hey, you know, we made it past it.
Yeah.
And we talked about this yesterday. You know, we made it through, but there are people that did not, and those loved ones which did make it through with us. That's something that they're going to have to always deal with. They've got even more of a reminder of what we went through.
And that they don't have some positive memories of, you know, those first. There are times where we step out for the first time and we can celebrate, you know, being with family without a mask. Well, some of those people were meeting for the first times without a loved one that they had before the pandemic started. So, our hearts go out to those people as well. We're going to end here. We're wrapping it up. We have some sound bites from a press conference where the city kind of wrapped all of this up and said that their work was essentially done and they were passing the responsibility onto the public. And some really great words came out of that press conference from city leaders that day.
And from a public policy standpoint, and now it is the responsibility of each of us in the community to continue to act prudently. But be clear, COVID is still here.
I couldn't have fathomed how we would possibly respond to more than 500 cases in one day, let alone 98 deaths in 1 month.
Working in environments that were similar to war zones, seeing and experiencing deaths at a rate no human being should ever have to witness.
It was a medical test. It was a commerce test. It was a political test. And it was definitely a social test. And I don't know about the rest of you, but I'm kind of tired of being tested for a while.
You will likely always remember where you were when that first case was announced.
To those who have lost loved ones forever due to this pandemic, I share your pain. We will never be able to replace those we have lost, but we certainly can continue to take measures to make sure their deaths were not in vain.
I know that's one issue we've not even gotten into, and I think we could talk for 6 or 7 more days about this, but he mentioned the political test.
Yes.
And so obviously in a lot of ways our political landscape was changed quite drastically because you had the people who were, you know, against the mandates, and they kind of rose up against that. And it's very interesting, and I'll just make this this observation. In one of the sound bites we had at the city council meeting, some of the people were saying, you know, don't make us wear masks. You know, if you want to, that's fine. You do you, we'll do us. But that has morphed in recent years, because now there are a few people who still like to wear masks. Those people are made fun of. You know, if they go out in public, they get weird stares. You see things online from people that do like to wear masks, people, you know, criticizing them, funny memes. We know what political party you're from. So it morphed from you do you, I do me to
being judged for
you're one of those kind or whatever. So once again, we're, whatever side you're on, it has affected our politics, and maybe forever in that sense as well. Yeah.
And I mean, a lot of the things that are going on in the U.S. and the world right now, could we say that it would have been different if we hadn't been through a pandemic? Because I think a lot of the ideals that people had at that time were solidified during the pandemic, and then it just kind of went on from there, whether good or bad. I mean, we came out on the other side of this pandemic definitely a more divisive society. I think, you know, people definitely had their views and went one way or the other, and maybe kind of stayed there. And social media also is good about reinforcing values as you scroll along, you know. So it's very interesting. I think for myself, one thing that I'm just really passionate about, and we talk about this a lot, is just how did we get here? How did we get here? And I can guarantee that life without this pandemic, if we wouldn't have had it, life would be different now. And it is different because of it. And so it's just interesting to look back and see. It was definitely it was like society under a microscope. And it was, how do people react when they're scared and they don't know what's coming next? And we saw it every day. That's how people react. Some people lean on each other. Some people, you know, You don't know.
Yeah, exactly. And that's, like you just mentioned, we've discussed this many times before. We're not here today because we were just blindly waltzing through the world. I mean, every single thing that happened for every topic in the world led us to today. And so it's good to look back in the past, see why we're here, and learn some lessons from what happened before that got us here.
And I mean, we always talk about, how to prepare for a natural disaster, how to prepare when the worst thing happens, prepare for severe weather season. You know, those in Cape Girardeau, prepare for an earthquake. You know, it's strange to see all of that actually be put to the test, and you know, in a health and medical aspect. It's like, not that I was one preparing for these pandemics, but there are people in our community, around the globe, in our country, that their sole job is to prepare for stuff like this.
Exactly.
And it's interesting to look back and see the steps that were taken to try to mitigate it, and it was put to the test. And whether we succeeded or not, we're here now. You know,
and learning that you can have a plan in place, and it's good to have a plan in place, like we do for tornadoes or fires or whatnot. What will you do if that happens? The pandemic, I think, was a prime example of, you can have a nice outline on paper, but when you get to it, you know, some things have to not be chucked out, but just redone, because you realize reality is different. And so a lot of this was learning as we went. It was a disease we hadn't seen before, and so learning the disease and learning how to deal with it.
Yep, absolutely. Well, it has been an interesting ride to look back on what happened on these days 5 years ago, the good and the bad, and how our lives have changed since, and in some ways gone back to normal, what we used to know. And we just hope you keep following along as we look back at some of the coverage we've had and bring you the very latest on everything.
Yeah. And how we got there.
Yeah. Exactly. Well, thanks for joining us. I'm Bailey Strohl with Mike Landis, and this wraps up our COVID-19 series 5 years later.
We'll see you soon.